That's just a heads up that we're planning on recording this. I'm Kirsten Conan. I'm a professor of psychiatric epidemiology in the epidemiology department and the head of the interdisciplinary concentration in population mental health. My work for my whole career has been on population mental health. I particularly focus on trauma and post-traumatic stress disorder in many different populations, as well as I do genetics work. Right now, my biggest genetic projects are in Africa and in Mexico, focused on the genetics of psychotic disorders. And so the goal of the session today is just to introduce the concentration and hopefully offer a chance to answer questions. I'm sharing my screen right now. So to just get started, I'll just go through a few things about the concentration. So this is relatively new. I think our first year was last year. So it is a new concentration. The concentration is open to any student at the Harvard T.H. Chan School of Public Health, whether master's or doctoral student, in any department. It's a little easier to meet the concentration requirements if you're in epi or epidemiology or social behavioral sciences, but it's certainly possible to do the concentration from any department, and you can do it, like I said, if you're a master's or a doctoral student. I will go through, and so the sort of requirements of the concentration are to complete a number of courses. And the goal is to get to take enough courses and do enough work in mental health while at the school that you kind of develop an expertise in mental health. And then the benefit of the concentration is you actually get a certificate. So you get a formal recognition that you can put on your resume and show people that you actually have completed this concentration in population mental health. So like I said, it's any student from the school is eligible. It's not available to students at other schools at Harvard at this point. I'm not sure that it ever will be. The concentrations are all right now within the school. Basically, anyone is eligible to do this. We don't review applications. What we do is I will show you is once you complete the coursework for the concentration, you fill out an information sheet, which we then sign off on, and then you get awarded the concentration. So there's not really an application process except that you have to complete the requirements. The requirements are 10 course credits, and they're distributed across a number of courses. So 5 credits are within, it's basically you have to take 2 of the 3 courses, if you can see my screen, which is Epi 217, Epi 219, or GHP 204. So you have to take two of these 3 to get your 5 credits, to get through the basic foundation in population mental health at the school. And then you have to take at least 1 of the mental health elective courses, and then 1 other course, which can be also a mental health elective. It could be a core course or it could be related elective courses. And that's it. That is the concentration. And then depending on your department, you need to just state to us that you've done a population mental health related practicum, thesis, or dissertation. So in the EPI department, it would be a thesis. If you're a PhD student, it'd be something in your dissertation. But other departments like social behavioral sciences don't have a thesis. And it's just to say that you've gotten some practical experience. So a research project or your practicum during your master's, for example, was related to population mental health. And that is basically it. We also encourage the students to, I'll leave this up so you can see the courses. We encourage students to attend our population mental health speaker series. So that we are updating the website. So in non-COVID times, the speaker series, we have speakers come to the school during the student lunch hour, and we actually offer lunch to students and once a month. And so you can meet the speaker and have lunch, they give a talk. during this virtual period, we're doing what's called Population Mental Health Forum, which are open to the public. So they are for students, they're for anyone. They're once a month on Wednesdays at 11 a.m. And we're working on making the links updated on the website. But we encourage people to attend those. They're not required during this time. Once we're back in person, we're likely to go back to our previous plan, which was to have speakers come during the student lunch hour, to offer students lunch, and also the opportunity to meet the speakers. And then I guess lastly, we are hoping to plan a research symposium to feature student research in mental health at the school for later in the spring. Again, you know, everything's a little different now because of COVID and we're all virtual, but those are the basics on this. I will stop sharing that and go 11 and see if there are any questions. You can feel free. This is a small enough group. You can feel free to just unmute and ask me questions, or you can put them in the chat if you're not comfortable doing that. So any questions from folks? I don't. Everyone's 100% clear. I think I'll just comment on some common questions that have come up previously. So for example, sometimes for students who are one-year MPH students or biostats master's students, which is a 1.5-year program, it's possible to do 10 credits in mental health, but not to do the exact combination of courses you saw on the list. So if people have issues like that, or a challenge where it's because a course is not offered, or if you find another course at the school that has mental health content that's not listed, please let us know. We tend to be pretty flexible with those kinds of approvals. And in fact, as courses are changing all the time and people are developing new courses, we're happy to include more courses, or it may make sense to take courses off if they're no longer being offered. So please, if something like that comes up, just email Zach and I, and we can, discuss it and look at it. But if the course includes mental health, I'm sure we would at least include it as one of the electives. Any questions from anyone? Oh,
I have a question.
Sure, great, go ahead.
My name is Renee Ori, and I'm in the field of public health as well. And my questions are more based on the population mental health of like what's going on currently in the United States and what sort of mental health issues that you have seen arise as a result of COVID. The reason I'm asking is because I actually work a lot in Africa and in refugee camps, and they are displaced populations and they have a different mental health issue to begin with. And then the COVID on top of it adds more complications. It's actually becoming more stressful for them. And I just want to relate it to what's going on here.
Sure. Yes, I can comment on that. Was one I can comment on that. Sure. Let me just do one other thing and then I will comment on that. Just want to make sure no one has any questions about the concentration itself at the school. And I'll just share one more thing, then I promise I will get back to your question. I just want to show people, sorry, the info sheet, the completion form. So just so people can see, this is the form. It is on the website, which I don't know if Zach, if you could just put the website for the concentration in the chat. It's you can link to it through the website, and you just fill it out, and you can see it's simple, and we will get it signed off on. So that's what you have to fill out. Okay. Other questions about the concentration? Yeah. So yeah, so it's a really good question. I mean, yes, I've been doing a bunch of work in population mental health during this time. And I guess, we know a lot. So a couple of things I refer you to is one is we actually have had in the spring and the summer, we had a population mental health forum focused on COVID. And all of those, I will put that in the chat. All of those uh, forums are recorded and all of the resources are online. So all the slides, any let's say information sheets or like resources people offered are all there. And they do cover, that's the link, and they do cover a number of different populations, including, but we didn't specifically, we did have a forum on mental health in Africa during COVID, but we didn't focus specifically on refugee populations. But I think briefly, if I could say what we've learned is that, that just like, anecdotally, people have said, COVID's affecting people's mental health, but I think the data has really borne that out. We have a number of studies that have looked at, for example, mental health in the US before and after COVID and found that there's been both an increase in like diagnosable depression and anxiety, for example, as well as just more symptoms. So like the population distribution of depression has just shifted where people have more symptoms, and that it's strongly related to people's, not surprisingly, other stressors and finance and assets. So people who've lost their jobs, lost their homes, have other kinds of economic stressors, like are likely to have worse mental health than people who have not, given, equal exposure to COVID. And then of course there's special populations like healthcare workers, essential workers. And I think the information on those populations is more mixed. Some people have found, like in China, found, really increased distress among healthcare workers. Some of the other studies haven't so much. So there's probably a lot of contextual and other factors, and depending on when the surveys were done, that influence the results. And then finally, for our group, we were involved in a global pregnancy survey. So women who were pregnant or gave birth recently during COVID-19. That survey was done in late May, early June. And we found very high prevalences of depression. We use screening tools, so screening people for depression, anxiety, and post-traumatic stress, and found very high rates of clinically significant symptoms, with 40, 50% of the women. And that was very consistent across country. So that was true in the US, but it was also true in Mexico, South Africa, and China, which were the countries we had the most respondents. And so, and the distress was related to, it's related to COVID, but it's also related to all the things that are related to COVID, like missing, not being able to go to the hospital appointments, not being able to have a support person at your delivery, people worried about their job or finances or, care of their children and their families. So that's to say is, yes, people worried about getting sick, but that was in the context of all these other stressors. So, but that's less myself. I've done work on refugees in other parts of my life, but not specifically related to the COVID pandemic, which obviously adds a whole nother layer to that.
Well, but the work that you all have done, is the census tract data open source?
People have done work in census tract, not us. We have a number of different, the pregnancy survey I mentioned, that is, will be open. It's in the process. It's like being cleaned and all that. So that will be open source. So some of the data, like I mentioned, some of it's not mine, is open, is out there, or some people have used publicly available data. And then other, other studies are, not publicly available because they're nested within cohorts of people that are, long-term cohorts. So it sort of depends on the study. It's not like one, I can't give one answer to that in terms
They
of.
should make it all open source. I really do, because it's like we could intercollaborate with global information.
Yes. Yeah, I agree. I'm all for open source. Some is, some is, some isn't. Sometimes it has to do with the privacy protections of the participants that makes it impossible to, or makes it more challenging, right? Especially if they're in a healthcare system. So, any of the other folks have any other questions about the concentration or anything specifically over here? Okay. Well, then I guess that's it. Going once, going twice, folks. Okay. Well, that's it. So like I said, check out the website. The forum is on the website. The classes, again, feel free to email Zach and I if you want to do the concentration, but there's something logistical, especially this year, that's challenging in terms of a course not being offered and you're graduating or something. Or if you find a course that you think should be included and it's not, just let us know. And like Zach said, in the thing is just more difficult for everyone this year. If that's it, that's great. Have a good luck with all your exams, everyone. And please take care. And thanks for joining us. And seriously, let us know if we can help in any way. Take care. Okay. Bye.
Thank you.
Thank you. Thanks. Bye-bye. Thanks, everyone. Bye-bye.